It gives me great pleasure to introduce to you this morning Professor Charlie Lakin, who is the current Director of the National Institute on Disability and Rehabilitation Research for the United States. Charlie brings to us today and brings to this conference 40 years of experience in service to people with disabilities, their families and those who support them, working tirelessly as a teacher, a researcher, a consultant, and I think closest to Charlie's heart, an advocate for people with disabilities and their families. Prior to taking on the enormity of the task at the National Institute on Disability and Rehabilitation Research, Charlie was the Director of the University of Minnesota's Research and Training Centre on Community Living. And I had the pleasure of spending some time and having some ongoing relationships with the team at the University of Minnesota. I think it's fair to say they sadly miss Charlie, but continue to forge ahead from strength to strength because of the foundations that Charlie laid. In his career, Charlie has directed dozens of research and training projects and has authored or co-authored over 300 publications. He's consulted frequently with state, federal and international agencies in matters of policy, research and evaluation. And among the many recognitions of his work are appointments by President Clinton to the President's Committee on Persons with Intellectual Disabilities, the American Association on Intellectual and Developmental Disabilities Dipwad Humanitarian Award, the University of Minnesota's Outstanding Community Service Award, and the Distinguished Research Award of the ARC of America. Charlie, on a personal level, has sustained his commitment to people with disabilities, their families and those who support them. He has worked with vision and in creating from this vision possibilities and practical solutions for the lives of people with disabilities. But I think most importantly what characterises Charlie is his incredible capacity to enable others to achieve their best. And I think this is most well seen in the work that he did at the University of Minnesota. So it gives me great pleasure to introduce to you Professor Charlie Lakin.
I also want to thank those of you who've travelled to North America to share with us your work and your knowledge and your commitments. I mean this from the bottom of my heart. You nourish us in so many important ways. And as Director of the National Institute on Disability and Rehabilitation Research, I want to assure you that the work that you're doing is important in guiding our work. We use it to develop our priorities and our plans, and to make the investments that we do with our limited funds on behalf of people with intellectual disabilities. In that regard, I want to acknowledge that Don Carlson, who's the primary manager of our portfolio in intellectual and developmental disabilities, is here, and I want you to know that Don and I are listening carefully to what you have to say. I was asked to talk a little bit about outcomes research from the perspective of a government agency, and sort of to focus on some of the lessons of the past and the present and prospects for the future. I'm happy to do that, but first, in the spirit of representing our government, I need to tell you a little bit about our agency. The National Institute on Disability and Rehabilitation Research, or NIDR as it's called for good reason, is the primary U.S. federal agency to promote research in disability and rehabilitation research. Our mission's very broad. We're called on to generate knowledge and promote its use, to help people with disabilities perform activities of their choice in the communities in which they live, and also to provide full opportunities and accommodations by the society to assist them to that end. And we're also asked to attend to all kinds of disabilities: spinal cord injury, traumatic brain injury, psychiatric disability, sensory impairments, and of course intellectual disability. And then in our efforts to help people become better included, more independent, more productive, we have a range of means with which we can pursue that end, including research, engineering, training, technical assistance, and knowledge translation. Knowledge translation is the process by which research is turned into information that informs policy programs and practices. And a key part of that translation process is ensuring that information is promptly and effectively disseminated to the people who really need it, who can really use it. Knowledge translation is a commitment of my agency, and standing here on Canadian soil, I really want to recognize the important role that the Canadian Institutes on Health Research have undertaken in developing and promoting knowledge translation as an important aspect of making the investments that we make in research really pay off for people with disabilities. Now, if your travels to this conference involved the new Boeing Dreamliner, you may have noticed that one of those toilets on the plane is accessible to people with disabilities. That toilet was designed by NIDER's Center on Accessible Transportation, and among NIDER's most important contributions over the years has been the development and the practice of the concepts of universal design, making the world available to all people, whether they are or have or do not have disabilities. And if you read Newsweek or the New England Journal of Medicine, for some of you more scholarly types, you may have noticed a recent article that talked about a drug trial that was held in multi-sites of a drug called amantadine that has increased the consciousness of people with severe traumatic brain injury. Those drug trials were done by participants in NIDER's traumatic brain injury model systems program. In the area of intellectual disabilities, NIDER's funded research and research translation that's played a significant role in the Olmsted decision, which promised that people with intellectual disabilities will have a place in the community in the United States. And I'm really proud of the work that the Obama administration has played in making sure that states attend to that Supreme Court decision. NIDER-funded research continues to support efforts by the administration to make sure that states obey the new law of the land in that regard. Because of its mission, NIDER's particularly interested in outcomes research. For NIDER, outcomes is defined simply as research intended to understand the end results of the different policies and practices, the different experiences and interventions that people with developmental disabilities experience. And we focus on the end results primarily in the areas of health, independent functioning, employment, community living, self-determination, and the general well-being of people with intellectual disabilities. But we also encourage researchers to look at outcomes that affect people other than persons with developmental disabilities. In recent years, we've had to pay much more attention to the costs and benefits of the services and programs and policies that have been created. In the United States, we face budgets that grow modestly, if at all. We have long waiting lists for our services. People with disabilities are living longer, and because of that, require more and more years of service. The intersection of demography and disability in the United States is a huge challenge, and I know it is all around the world. Just as an example of that challenge, in the United States, right now we have about 5 people in the working age of 20 to 64 per person with substantial disability. In 2040, that ratio will go from 5 people to 3.5 people of working age per person with substantial disability in the United States. So in recent years, we've had to attend much more carefully to the costs of achieving the outcomes that we want for people with intellectual disabilities. In some areas, that analysis is pretty straightforward. We've found in the United States that the cost of community services is much cheaper than institutional care, and we've also found through our research that the outcomes for people with intellectual disabilities are better in almost every conceivable way when they live in the community. But in other areas, we really have a lot more to learn. We know that the fastest growing circumstance for people with disabilities in the United States is to receive services while continuing to live with their family members. In the past decade, 2/3 of the people who have come into services in the United States have begun to receive services while living with their family members. 2/3 of the new service recipients. It costs a lot less to serve people while they live with family members, about 1/3 of the cost of congregate care. And we've also learned from the people who continue to live with their families that their reported outcomes of services are as good or better as people who live in community group homes. But where we've not been particularly attentive is to what all that means for the family members. We know there's some positive outcomes, and Rudd and Ann Turnbull have been so effective in telling of those over the years. But we also know from sort of some simple indicators that there are real costs to families when they provide for their family member at home. And those costs can range from income and career choice commitments that they make to costs of social life and even increased divorce rates and so forth. So one of the commitments we made at NIDER is to attend much more carefully to the experience of families and what we can do to better understand and better respond to their needs. So outcome research really tells us a lot about both the indirect and direct outcomes of what it is we do. Finally, at NIDER, we view the ultimate goal of outcome research as gathering and sharing knowledge that can guide decision-making. Decision-making by persons with disabilities, decision-making by policymakers, decision-making by service providers. We expect that the research we fund should help people make decisions. And to that end, we are strongly committed to make sure our investments are in research that address outcomes that really matter to people, that we find ways of measuring outcomes that are valid for the topics that we fund, that our research appropriately responds to the populations and practices that we're studying, that our research designs and analyses are appropriately sophisticated for the issues being studied. We get all sorts of data that fails to control for the factors that confound results and distort conclusions. And they aren't helpful to us as we try to help people make decisions. Finally, to really qualify as outcome research, the results really need to get to the end users and in ways that they can understand and act upon. My agency is committing additional funding and increasing its expectation that our 230 grantees get a lot better at getting the findings of their research to people who need it. It's just not enough to do research and publish papers. Disability research that doesn't affect people with disabilities is pointless. Excuse me here. You know, we really need to be honest about this. Many people with disabilities feel that much, if not most, of the research we all conduct is fairly pointless. They think researchers do research with little interest in how it will affect people with disabilities. I really love this picture. I keep it close to me at all times because it reminds me of our responsibility in that regard. I don't know if you can see it well, but it's a picture of a person at a rally, and you can imagine the crowd chanting. The sign says, "What do we want?" And the crowd chants back, "Evidence-based change." And the leader says, "When do we want it?" And the crowd chants back, "After peer review." Well, this, of course, is sarcastic. The reality is that many in the disability community feel that research and the research enterprise has little to do with their lives. And I guess the reason is that too much of the research does have too little to do with people's lives and too little to do with really identifying and promoting the important outcomes that people do want. One of the reasons that NIDR is so committed to outcomes research is that it's transformative, and I'd like to tell a little story in that regard. No, this isn't Roger Stancliffe. It's Walter Fernald. Fernald was an extremely influential person in the lives of people with intellectual disabilities, almost exactly a century ago. He was a superintendent of a large institution in Massachusetts. And he and other institution leaders and civic leaders and even religious leaders in the United States joined in sounding what today we refer to as America's eugenics alarm. There was a lot of unscientific genealogical research, along with really a national hysteria about immigration into the United States in the early part of the 20th century, primarily immigration from Southern Europe, and all sorts of racial undertones. All this convinced a lot of professionals, a lot of clerics, a lot of civic leaders to embrace a movement called eugenics. And really what they were advocating was a science of improving the human race by better breeding, much along the lines of animal husbandry. And they really advocated that sterilization and isolation of persons with disabilities had to happen, otherwise the human race would be diminished. And this is just a picture, I think Jerry Smith actually shared this with me, of a newspaper article in which Fernald was recognized as advocating the prohibition of marriage among people with intellectual disabilities. Now, Fernald's argument was both cold and cruel. 100 years ago this year, he wrote that the feeble-minded are a parasitic, predatory class, never capable of self-support or of managing their own affairs. The great majority ultimately become public charges in some form. They are a menace and a danger to the community. Feeble-minded women are almost invariably immoral and usually become carriers of venereal disease or give birth to children who are as defective as themselves. And he was quite successful, he and his cohorts, in convincing Americans of the vision that they had of the dangers of people with intellectual disabilities and the danger to society of allowing these people to roam freely in society. But, you know, he wasn't satisfied with that level of progress. He felt he really needed to prove this to make a point to those who were yet unconvinced. And he came up with a way of doing that. Between 1890 and 1915, about 1,500 people had left the institution that Fernald managed. Some had run away, some had their families come and get them, but almost all of them left under protest from the institution. And Fernald believed that by conducting a research study that followed up on those individuals who'd left, he could show just how dangerous it was to have people with intellectual disabilities living within the society. Altogether, he was able to locate about 650 individuals, and he was convinced that among the men he would find large numbers of criminals. He would find people who were homeless and in some way or another a menace to their community. But what he found was something that was quite different. Of the nearly 500 men that he was able to locate, only 12% had ever been arrested, and of those, only 7% had ever been to jail. Less than a quarter had ever returned for any period of time to an institutional setting. The majority were living independently in the community or living with their families, and Fernald was shocked by this result. He reported, "We honestly believe that nearly all these people should have remained in the institution indefinitely." And among the women, his findings were even more startling. Only 7% of the women were unmarried mothers, only 20% had had children at all, and most startling of all, Fernald reported that the social worker saw nearly all of these children and was not sure that any of them were defective. That is, any of them had an intellectual disability. Now, what happened next is the lesson that I take from Fernald. He did his study, he had his outcomes, and somewhat like Paul on the way to Damascus, he changed his religion. From being a persecutor of people with intellectual disabilities, he became an advocate of community and family living. He concluded that if people could be given a nurturing environment, there was neither a need nor a benefit from being put in an institution. And aided by Fernald's research in the United States in the period between 1910 and 1926, the ratio of discharges to admissions went from 1 to 4 to 1 to 2, doubled in just those 15 years as the outcomes of Fernald's and other studies begin to have their effect in America. Of course, to the eternal shame of the United States, that philosophy that was developed by Fernald and others crossed the Atlantic and was adopted by the Nazis and became the basis for the Holocaust of people with disabilities in Europe. But anyway, outcomes research can be transformative. It can be personally transformative, it can be socially transformative, but it requires both data on outcomes and it requires people with passion. Research without advocacy has little chance to make a difference, and certainly in the United States, we found that the outcome studies of people leaving institutions and moving to the community in the 1970s and 1980s and 1990s, when put in the hands of passionate advocates, can change a society, and it did. So these studies moved America from not really knowing why people would be put in institutions, but they were put there because there was no other reason, no other way to deal with them, to a real passion and understanding that institutions were very harmful for people and that the challenge was to get people out. And as a result, over the past 35 years, the number of people in public institutions in the United States has decreased by almost 90%. So that combination of data and passionate advocates has been incredibly important. Anyway, so that's the past, way past in outcomes research from my perspective, and I'm certainly not going to spend too much time talking about the present. The present's really the topic of this conference. You've all heard from Roger Stancliffe and Sarah Taub and Chaz Mosley and Harold Kleinert and others about some of the work from the National Core Indicators. That program is really playing an important role in increasing knowledge about outcomes of different approaches to community living in the United States. Certainly my agency is very pleased to have been able to contribute to that work. that work really challenges us to find the strength to confront our past beliefs. You know, we've spent in the United States the past 25 years trying to make group homes smaller and smaller. And now we're finding, because of the work with the National Core Indicators, that it really doesn't matter what size a staffed group home is, as long as it's sort of smaller than 8 or 9 residents. The outcomes for people, things like community participation, whether they like where they live, whether they have choices in their daily lives, it really doesn't matter much if you're in a staff group home of 3 or 4, or you're in a staff group home of 6 or 7 residents. The outcomes are pretty much the same. And there are many other results that are really challenging our expectations, and we really do need the courage to share this information and to use this information to change what it is we're advocating for. And again, I think there's much to stimulate that kind of thinking in this conference. I would like to look just briefly at something's happened to my clock. Huh? Really? No. Huh? No, I mean, it's just stopped. But anyway.
I make it you've got at least another 3 minutes.
3 minutes, that's about what I was thinking. Anyway, I'd like to look just sort of briefly toward the future of outcomes research, especially in the context of this conference. One of the roles that my agency has is to be engaged in research internationally, and that's really been a challenge for us because our budgets have been fixed for about a decade. We have growing expectations for the work we do, and we really challenge to be engaged internationally. But I'm encouraged about the prospects. You know, I really love our Americans with Disabilities Act. It's been incredibly helpful, but my encouragement really comes from the international adoption of the United Nations Convention on the Rights of Persons with Disabilities. I think we have, through that convention, a structure for sharing the work that we do, and can be a great catalyst for international work around the promises that have been made to people under the convention. That convention is full of measurable. Okay, there we go. Now I'm at 5 minutes. I'm getting more time. So I think we can find in the UN Convention and its principles things that we all are committed to, things like dignity and autonomy, the freedom for people to make choices for themselves, inclusion, the adoption of assistive technologies. And really, in the articles, we find very specific identification of outcomes that we can work on together. Article 19 calls on us to provide people with the opportunity to choose their place of residence, where and with whom they'll live. Data from the NCI have shown us that we've got a long way to go in the United States, at least, in fulfilling the promises that have been made in the UN Convention. It promises that people are going to have a range of community supports and to support inclusion in the community and to prevent isolation and segregation, yet the National Core Indicators and other data show us that loneliness is a pervasive experience of people with intellectual disabilities in the United States, especially those who live in group situations. So I'm encouraged that the UN Convention provides us a way that we can share a mutual commitment to the well-being of people with disabilities that cuts across the borders between our countries. You know, there's a lot in Article 19. Article 25 on health provides us great guidance. There's an article on habilitation and rehabilitation that notes our obligation to work together in training of professionals and paraprofessionals and staff of community residents. there's a great deal we can do together, and I think in that regard, you know, I can't talk about staff development without remembering Jim Mansell and his passing and the great loss that that is to us, certainly. But we will continue in those areas. We have articles that call on us to improve the access to assistive technology. We do a lot in NIDR in the area of assistive technology, but in some areas, the main leadership is coming out of Europe, particularly in the area of cloud computing. And we need to support each other in these areas. You know, I could go on and on. Article 27 on employment, my word, we're doing so terribly in our end results in employment in the United States, and hopefully there are those of you internationally who can help us. Well, anyway, I'd like to just sort of make one other point, and that's from Article 32 of the Convention. It notes that and recognizes the importance of international cooperation, and we just need to ensure that our work is inclusive and accessible to people with disabilities, that it facilitates and supports capacity building, including the exchange and sharing of information, experiences and training programs and best practices. These are right out of the convention, that we cooperate in research and approach providing appropriate access to scientific and technical knowledge, that we cooperate in the area of technical and economic assistance. These are right out of the convention. These are exciting and manageable challenges. If we accept the challenges, we can make an enormous difference across borders and around the world. We at NIDR really want to be part of an international community that takes seriously these promises made in the convention. We look forward to being parts of efforts to use the enormous potential of technology to help us capture and share information across the world so that we can better achieve the outcomes promised to people in the convention. And then in the arena of ID and standing here in the native land of knowledge translation, I just think this would be a great undertaking for IASSID. Well, with that, thank you. I'm 8 seconds over, so I'll sit down quickly. Thank you.